Okay. So shall I start?
I'll start.
Okay.
Yeah. Hi, friends. This is Dr. Vijay, Medical Oncology faculty from DocTutorials. This is a great moment both for the teacher and the student. We are here to discuss on how our AML rank 1, CML rank 1, Dr. Nehar, has gone through his journey, achieved something which everyone wanted to do when they are writing their NEET or INI. So this session of next few minutes is going to be his journey, how he is prepared, how he wants others to kind of focus, and so on. Hi Nehar, how are you and how
Yeah,
are
good.
things?
They are fine right now. Currently, I am on duty, so I've just taken some time off, so I can like guide others how to go through this and like achieve such things.
Right. First of all, hearty congratulations from the DocTutorials team. Something which
Yes.
is a dream for so many people has come as a true thing for you. Getting into INI is a big thing. Getting into the branch of interest is bigger. And getting the top in a reputed institute, I don't think anything else equates now after this result for you for what you have actually gone through the past few months to years. So how do
Yes,
you
sir.
feel now after this result?
I feel
What were you doing during
great.
the result? I know that.
Actually, when during the result, I was in daycare only. I was starting chemotherapies and also I had my duties in the ED. So I had just gone to the ED and like I had seen a few cases of febrile neutropenia and managed them. And then I had come back to daycare and I was starting chemotherapy. And in between, I checked my phone and I saw that the result had come. So then I checked it and then I found out that like I got this rank.
Right. How was the moment? An extra add-on or a relieved moment?
It was mainly a moment of relief for me because I I was happy at the same time. More than happy, I was relieved that everything is done finally, and it I have achieved what I was preparing for in the last few months, and they were worth it.
So tell me about you, Nehar. Where was your UG, then your PG, and what was your experience during that time?
So basically, I had done my UG from SS Medical College and KM Hospital in Mumbai, and I had done my PG from PGI Chandigarh. And regarding my experience and how I developed my interest in medical
What was your
oncology,
PG?
yes, sir.
What was your PG on?
In internal medicine, sir, at PGSF.
Your post general medicine, because this I wanted to be even more particular because now with so much of specialties getting into the subspecialties getting into a proper exam of that specialty, I think people with the medicine background, if you really have an interest, it is possible and you have an example for such a rank holder now. So you don't have to doubt as to whether you're going to compete with the other branch which already has some exposure into oncology. Nothing of that kind is going to actually decide on who gets into the top rank as well. Yes, Negar, what? So why
So,
oncology? How did this interest come into the picture?
so basically, when I was in my MBBS, so in our third year, we had this summer camp at Tata Memorial Hospital where 10 days we, as third year students, we attended different multidisciplinary meetings and how different specialists they approach cancer. So at that time, I developed an interest in oncology because I feel that it is unlike different subspecialties in medicine. It is not restricted to a particular system. It is multi-systemic, and we see patients from all kinds of specialties. Even we see gynecological patients. Even we are seeing surgical patients. So we are not restricted to a particular system per se. And my interest further developed in when I was internal medicine. I was doing my internal medicine PG at Chandigarh, and we were posted in the clinical hematology and medical oncology department. And we were exposed to cases like lymphoma, acute leukemias, and febrile neutropenia. Then also we had some solid exposure like CA lung. So my interest further developed during that time. So from the onset, like from the first day of PG, I knew that I was going to take medical oncology.
So there is a clarity of someone who's wanting a subspecialty right from the time that he has started his specialty. And this actually a driving force. People start having an interest based on what they see during their UG and PG. And then as the interest develops, when you are trying to dedicate most of your time into the preparation as what is warranted in that subspecialty, things will actually set in. And here is one other example for that. So now that you have told me why oncology, and you have, so how long did it take? When did you finish your medicine?
I just finished it around 4 months back. I finished my MD medicine in August of 25, and since that time, and after that, I joined as a
Right.
senior resident at.
So we got someone just completed medicine, and the time period for you was hardly some 4 months, if I'm right.
Yes, sir.
So less than even 4 months. Now let me know as to how DocTutorials come into the picture. Why DocTutorials, and how did you know whom, through whom, or and so on, and how did the help actually add on to the already going on preparation?
So basically, since during my MD period, I was sure that I will be appearing for the INI SS Oncology exam. So when I was in my fourth semester, that is in my second year, we had 6 months of free duties, basically where we could uh, dedicate some time to studying. So during that time, I was going through all the resources like which from where I can read medical oncology. So I came through some of the few of the doctoral sample videos uh, on medical oncology. And I like the way that different cancers were approached, and I like that how specific topics were discussed. So that time I got the doctoral package, and I started my preparation from there. That time. So my preparation, like the initial reading was in my fourth semester, uh, and then in the fifth semester and sixth semester, I had more hectic duties, and my exam was also there. For that was a 1 year gap. So by the time I had finished MD, I was already prepared with the notes of medical oncology. So I just had to revise them, uh, and that is how it helped. And again, like uh, during my final days of my preparation, there were the best resource which I found was the revision videos, the QRP sessions. So I went through them twice before the exam, and also there was certain update videos in certain subspecialties, like there was updates in thoracic oncology and breast oncology. So I went through those videos again just 2 days before the exam. So they helped me to crack a lot of questions which were based on how you approach different cases and that like that.
So when did this DocTutorials get into the picture? August 2025, if I'm right.
Actually, I got the package in March of 2024. Basically, when I was in my fourth semester.
Something this is
So
very
I
interesting
used
for us also. We have been doing some residency videos. I think whoever is wanting some such specialty, the DocTutorials team is also going to be encouraging them to get into this kind of packages during their residency, which will actually add on to this already existing stimulus when you start understanding the concepts before even just reading and showing. It actually boosts your energy and keeps your mood set in for that subspecialty. I think this is something which is new for us also. We'll start finding out whoever is wanting to take a subspecialty in during their residency, encourage them to get an exposure to such videos, which will one
hello.
get to know them. Yeah, yeah, Nehar.
Yes. Uh, yes.
Yeah, no problem. I think there is
Yeah,
a
yeah.
issue of the network. No issues, no problem. So just
Okay,
to
okay.
finish off my story, and that might add on to the already existing motivation that this kind of preparation. It doesn't mean that you're not going to prepare your medicine or whatever specialty you are in. It is during the free times or whenever you get such a case during your medicine also, when you are able to go through some videos or go through some of the texts which are there, will help you in understanding the concepts, will actually make another extra edge to the already existing motivation as well. And the most important, Nehar, what do you want these students how do you want these students to prepare, from what book? The first question which we get is what book? Should we go through the data full? Should we know about anything in NCCN? So there are so many questions for the newcomers who are wanting to get into medical oncology. What do you want to tell them as an advice from your end?
Uh, uh, Hello.
Yeah, Nehar.
I think there has been some issue in the connection. So, sir, regarding what to read for medical oncology, so I feel that
Nehar, you are muted, I feel,
data
suppose. Can you unmute?
is audible now.
You aren't.
Hello. I'll Hello, sir. Am I audible? Okay, I'll join again. And yes, sir. Am I audible right now? Hello.
Should I? Hi, Nehar.
Uh,
Yeah.
yes, sir. Am I audible, sir?
Yeah, you are.
Yeah. So, sir, regarding the preparation regarding Davita, I feel that about reading Davita, only the first few chapters related to the general oncology part, which is the drugs and the chemotherapy drugs and epidemiology and biostatistics. That part is the most that part is necessary. Regarding the systemic oncology, I feel that Davita itself it is published every 3 to 4 years. So by the time we are giving our exams, it the information in Davita is already outdated. So the new information, the new guidelines of how different cancers are managed, they are already discussed in the DocTutorial videos and the latest videos and the update videos, so we can refer to them. And Devita, if one wants to read, then only the initial 800 pages, that to the tables, are important. Apart from that, reading the whole Devita, I don't feel it is necessary.
Perfect. Much needed information for whoever is wanting to prepare. The fear is all about data and so on, but it is only for exit exams. For an entrance exam, you need not kind of fear of completing a data. Concepts are important. Initial general oncology and the final few chapters of the management of patients with hypercalcemia, febrile neutropenia, all these complications related and supportive care related chapters are going to be important. We have prepared videos right from every other textbook which is important, which is up to date, and the videos are on as well, so that which will actually help you in understanding the concepts before even you get into the theory. And that is from our end. Any final words, Nehar?
Uh, so regarding final words regarding the INSS exam, I feel that in addition to preparing for for the specialty part, I feel a lot of places where the students miss, and because of that, they, even though they have prepared well, but they are not able to score, is the general medicine part. Because general medicine, because the specialty part is 50 questions and the general medicine part is 30 questions. So that is where a lot of students miss the marks because they are already preparing for the specialty and they leave general medicine. And the thing about general medicine, the questions are very straightforward and they are very easy if one has read the previous year questions and they have discussed the topics, which I feel a lot of me and a lot of my batchmates did, that we discussed the previous year questions and we discussed the topics again and again. So that helped us score more in the general medicine part, which helped us to get such ranks.
One other important point brought about now by Dr. Nehar is previous year questions. Do not neglect those. It is more informative. You might get questions of the similar kind, or it might guide you as to how you should approach a question and how is the question being asked in exams. So never miss previous year questions. Trying to solve them actually adds on to your preparation. And that is it. Thank you, Nehar. All the best.
Thank
We'll
you so
be
much, sir.
again meeting with the, as a colleague in conferences, and all the best for your future. Thank you.
Yes, sir. Thank you so much, sir. I also see forward, sir, to that, sir.
Thank you so much.
Thank you, sir.